Now that we've established the importance of having both airflow signals, let's walk through a few clinical scenarios. Even when a setup appears perfect in the room, the signals may not always reflect the patient's true condition. Recognizing these patterns is essential for both patient safety and accurate scoring. Misleading signals can result in incorrect scoring, or worse, missed signs of patient distress. Case number 1, patient distress versus system failure. In this example, both airflow signals are absent, while respiratory effort is still present. At the same time, the patient is showing significant desaturation and rising CO2. This indicates not only a system issue, but also active patient distress. When signal loss is accompanied by desaturation and rising CO2, always treat the patient first and assume the situation is clinically significant. Immediate assessment of both the patient and the equipment is required. This pattern suggests ineffective airflow despite respiratory effort, which may be due to airway obstruction, such as secretions, or a disruption in the airflow circuit. Assess the patient immediately. Follow facility protocol and allow respiratory therapists to assess the patient. Check for airway obstruction, such as a mucus plug or thick secretions at the tracheostomy opening. Look for any visible secretions. Suctioning may be required to clear the airway. Ensure airway patency. Patient positioning can also affect airflow. Neck flexion may partially narrow the airway or alter tracheostomy alignment. Optimizing positioning by elevating the head of the bed and correcting neck flexion can improve airway alignment and support effective ventilation. Case number 2, PTAF and differential flow discrepancy. In this example, airflow signals are absent. However, unlike the previous case, the patient is not showing signs of distress. The patient remains clinically stable, with normal oxygen saturation and CO2 levels. Flat airflow signals alone do not indicate patient distress. Always correlate signals with the patient's clinical status. Check the circuit connections. This pattern may indicate a disconnection within the circuit, such as corrugated tubing becoming detached from the tracheostomy interface, or the need for patient repositioning. Case number 3, flat differential flow signal. In this example, airflow appears flat. This may occur if the thermistor has become displaced from the tracheostomy ventilation port, or if the sensor is damaged, or if it is connected to the incorrect differential channel. Check thermistor position. Ensure the thermistor is properly positioned at the tracheostomy ventilation port and aligned with the airflow stream. If air isn't passing directly over the sensor won't read airflow. Check sensor quality. Excessive bending or repeated stress on the thermistor wire can damage the internal components, leading to signal loss or inaccurate readings. Check sensor connection. Verify the sensor is correctly connected at the differential channel on the brake box. Case number 4, flat PTAF, good differential flow. Here, the PTAF signal is flat, while differential flow remains present. This pattern may indicate a sampling line issue, such as occlusion or moisture buildup, rather than a true airflow problem. This is a high-yield distinction. While differential flow remains present, the PTAF signal is flat. This pattern can sometimes be mistaken for apnea. Moisture buildup can obstruct the sampling line and affect PTAF signal accuracy. Clues that this may be due to moisture include a gradual decrease in the PTAF signal before it becomes flat, yet the diff flow remains unchanged and the patient appears clinically stable. Inspect the sampling line for moisture and clear or replace it if needed. In some cases, the sampling line may be gently flushed. However, replacing the line is often preferred to ensure signal accuracy. Understanding the difference between patient distress and system-related issues is essential for accurate interpretation and patient safety. Always correlate signals with the patient's clinical status and troubleshoot systematically. Thank you for watching. I hope this helped clarify common signal patterns and troubleshooting approaches.